Hi, good morning, Lucas. My name is Olivia Morris. I'm your invigilator for the OET speaking session on the 19th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell your full name for the record, please?
My full name is Lucas Tyler.
And what is your candidate number, please?
My candidate number is 214215532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Describe a situation when you have to work closely with a difficult coworker. How did you handle the situation?
Working closely with difficult coworkers can be challenging. But it is important to remember the patient, their care, and their family, which is the most valued. Putting aside the differences is essential for all nurses, because not everyone is the same. Sometimes this means not to discuss specific topics such as religion or politics at work. With that being said, not everyone will become friends in the workplace, but working together is key for the successful care of the patients.
Talk about a conflict within your healthcare team. What was the conflict? And how did you handle it?
Conflict often occurs in the hospital setting, particularly between new nurses and more seasoned staff, as well as doctors and nurses. One specific time, there was concern from a parent that a newer nurse was not monitoring the patient's breathing post-operatively as closely as she would have liked. I was covering the nurse for lunch, and the mother brought her concerns to me. I discussed and validated her concerns. Once the nurse was back from lunch, I spoke with her regarding the mother's concerns. The nurse was very upset, and felt it was not my place to say anything to her regarding this. A parent's or patient's concerns should never be dismissed. I spoke to the nurse educator on the unit, to use the opportunity as a teaching moment.
Describe a time you provided an effective patient or family education.
After teaching families, I asked them to repeat the information in their own words. Using teach-back method allows nurses to know if the families truly understood the information that was given to them. It is also important to provide the family with written educational material and use other forms of education such as videos or hands-on when possible. I taught a family post-operative spine care after a posterior spinal fusion. The parents were able to properly demonstrate how to transfer their child from the bed to the chair. In doing so, I was able to determine that they had retained the information.
Give an example of a time you had to interact with a hostile patient. How did you handle the situation? And what was the outcome?
Unfortunately, hostile patients often are part of the job. It's important to remember some of the patients are being hostile because they are in pain, away from family, and in the hospital setting. There was a time when a patient refused to take her medication. I tried everything, but she would spit them out at me when she tried to take them. Because of this behavior, I involved my charge nurse, the physician in charge of her care, and the social worker. After many conversations and phone calls, it was determined the patient was spitting the medication out because she liked it mixed in chocolate pudding. The woman was elderly and suffered from dementia. It was only after speaking with a social worker we learned of her medication preference. She was not able to communicate with us about her wants and needs, and this led to hostility.
Describe a time you were faced with a patient who chose not to communicate or disclose important information. How did you handle the situation and what was the outcome?
A parent once didn't disclose that the father of the child was not her current boyfriend. This was important, as the patient was going to need consent forms signed. And legally, this boyfriend was not able to sign the consent forms. Additionally, there was a man calling the unit, claiming to be the father of the child. social work and the nurse manager were notified. Through an open conversation, the mother disclosed the correct identity of the father. While I personally did not discover the information, it is essential to know the resources that are available to you and utilize them to the best of your ability.
Great. Thank you very much for sharing that. So, let's move on to the role now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Hello, good morning, Olivia. I am your nurse Lucas Tyler here. How are you today?
Good morning, nurse. I'm good. Thank you for asking.
Great. May I know, do you have any pain, or do you experience any difficulties, please?
I feel a bit of pain, but it's not to be considered. And I don't have any other difficulties.
Good to hear, Olivia. I am really glad to hear about your post-surgery improvements.
Thank you.
At the same time, I would like to recommend you to make some mild movements for the further improvement of your condition.
Well, nurse, I think I need some more rest before making any physical movements.
I understand, your thoughts are fair and sensible. Nevertheless, you are now fit to make movements. Nominal walking with the help of a walker is essential after the surgery.
But nurse, I am not confident enough.
I hear what you're saying. But, would you please make it more clear? So, I could help you.
Nurse, I fear, is my knee okay to make movements, and could bear me as I stand? Also, I felt as if I would feel pain, which I don't want to experience.
I appreciate it, as you share your concerns with me. I don't deny it. There will be pain for some time. But the pain is subtle. Now, Olivia, I would like to draw your attention to my words. Forget about pain and your concerns for the movement.
All right, I will. You may please.
Thank you, Olivia. The knee is a part that is used for mobility. Knee needs exercise to function properly. And exercise will enable you to strengthen your knee muscles. It will help you to regain mobility and recover faster, and also ensures that any replacements or repairs made during surgery heal properly. This is also an excellent option for managing pain, and helps many patients to avoid or limit pain medications. I hope you can follow me, Olivia.
Yes, I can follow you.
That's great. In order to make movements, the knee muscles should be able to expand and contract. Isn't it, Olivia?
Yes. It is.
If you do not walk, or do not follow the prescribed exercise program, both during and after hospitalization, you may not regain the mobility you were hoping for. Because the knee won't be flexible and the knee muscles cannot expand and contract. Also, the pain persists. Hence, only if you walk and do the required exercise, your knee will be functional as you think.
All right, nurse. I understand what you say. But nurse, how sure you are that my knee is ready to walk?
Olivia, it's not like other surgeries. Knee surgery requires less time to heal.
But, what if I fall when I walk?
Okay. Currently, you can use a walker, cane, or walking stick to aid while you walk. It reduces the risk of falls, and also helps you to relieve your pain, to an extent.
Yes, I understand.
At present, I only want you to do a minimum of walking in the ward. Slowly, thereafter, you will be able to walk much better without the aid.
Okay, nurse. I will walk using the help of a walker.
I am glad to hear that. Don't worry, we will be always present with you when you walk. And it will provide mental support to you as well.
Yes, nurse. That will be great, if you can provide assistance for me, initially.
Sure, with pleasure, Olivia. Also, the physiotherapist will provide you with mild exercises to enhance the flexibility.
That will give me much confidence as well, nurse.
That sounds awesome. I will arrange a care assistant for you. And the assistant will take you for a walk. Is there anything else I can do for you?
No, nurse. I am all good. Thank you.
That's great. I hope it won't be long before you're on your feet again.
Thank you, nurse.
You are always welcome.
That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.